your host, Amberlyn Carroll. Thank you for joining us on this episode of MedWatch Today. Sickle cell disease is a genetic disorder that affects more than 100,000 Americans. And for some patients, when they experience a sickle cell crisis, the pain they feel can be excruciating and sometimes leave them feeling alone.
Stress is a big trigger, not eating right, not staying hydrated. Those all play a part in it.
Calvin Mays Jr. was a firefighter for 14 years in Illinois, but he's battled more than just fires, living with sickle cell disease.
It's very painful, excruciating pain when you go through a heavy crisis.
Sickle cell disease is a genetic blood disorder that causes red blood cells to change shape, so they can't easily move through small blood vessels in the body. And over time, reduced blood flow can lead to organ failure and stroke.
When I would get severe pain, I would go to the ER. Sometimes I'd have to wait an hour, 2 hours just to even get any kind of pain medicine to relieve it.
After moving his family to California, Calvin says the next crisis he experienced was so excruciating that he went to the emergency room at Clovis Community and was immediately referred to the Adult Sickle Cell Clinic.
In the United States, the overall life expectancy is at least 10 years lower for sickle cell patients. In California, the story is even worse. Life expectancy for an adult with sickle cell is about 42, 43 years, which is at least 20 years lower than the national average.
Dr. Mohammed Bukari is the director of the Adult Sickle Cell Clinic at the Community Cancer Institute.
The goal of the clinic is, number one, to provide high quality care for patients and hopefully improve the quality of life and life expectancy for patients living with sickle cell disease. Sickle cell disease is a disease which is predominant in individuals of African or African American ancestry and Hispanic ancestry. But of course, with interracial and interethnic marriages nowadays, it is not unusual to find sickle cell disease in second, third, or fourth generation.
Stephanie Harris Mercado is a physician assistant working alongside Dr. Bukari and says she's able to relate to some patients on another level when they come through the clinic.
Working in this clinic as a person of color, it helps me to identify with the patients and it helps provide health equity for our sickle cell patients who are primarily from the minority population.
For the last year, Calvin's worked with Dr. Bukari's team, who are trained in helping patients manage sickle cell disease.
It's very important that they have somebody they can identify with in the clinic.
I consider Dr. Bukari and Stephanie as an extended family. We stay in communication. They're very informative about things that I need to know about sickle cell.
I'm a sickle cell carrier patient, or I have sickle cell trait, but providing care for patients with the disease gives me a lot of satisfaction.